Good day, everyone, especially to our learners, teachers, and parents who are reached by this virtual activity. I am Lizette Gwendolyn More, Nurse 2 of the Health and Nutrition section of DepEd Agusan del Norte Division. My topic is about smoking and COVID-19, a deadly duo. The objectives of this activity are: at the end of the discussion, our learners, as well as the rest of our participants, will be able to, number one, identify the ill effects of smoking, mahibawan kung unsang mga kadaot nga mahatag sa pagpanigarilyo. Number two, understand how smoking predisposes an individual to COVID-19 and other diseases. Masabtan kung nganong ang tao nga manigarilyo mas dali nga mataptan sa nagkalain-laing mga sakit, apil na ang COVID-19. And number three, enumerate ways on how to stay smoke-free and safe during the COVID-19 pandemic. Makasulti og mga pamaagi kung unsaon nga magpabiling dili lulong sa pagpanigarilyo ug magpabiling luwas sa nagkalain-laing mga sakit ug COVID-19 niining panahona. So to start, let's have a picture of the extent of tobacco use. According to the World Health Organization, or WHO, globally there are 1.337 billion people who smoke. Annually, there are 8.2 million deaths. 7 million of these deaths are caused by first-hand smoke, while 1.2 million of these deaths are caused by second-hand smoke. When we say first-hand smoke, this refers to the smokers, while when we say second-hand smoke, this refers to people who are just exposed to tobacco smoke. They are the non-smokers. We also have the third-hand smoke or residual smoke, which pertains to the smell or to the smoke that is being retained on clothing, on curtains, on furnitures, on foams, on articles that readily absorbs the smell or the tobacco smoke. You cannot see it here on my slide that it is accountable for deaths of people because there's no solid evidence yet that it can cause damage to the health of human beings, while on a study conducted on mice or sa mga ilaga, there it was found out that it could damage their lungs. Now going to a smaller scale, which is the Philippines. Again, according to the World Health Organization, the Philippines is among the 15 largest consumers of cigarettes in the world, with 1 in 5 students already a cigarette smoker, and with a count of 10 deaths every hour, which is equivalent to 86,400 deaths per year. Now we have the pathway of a breath. So when a person breathes, the air enters through the nose. It goes to the nasal cavity, wherein it is moistened and warmed and filtered of dust, irritants, and pollutants. It goes down to the pharynx or the throat, then to the larynx or the voice box, to the trachea, and then it goes either to the left bronchi or the right bronchi. It further goes to the bronchioles. These branch-like structures are the bronchioles. And then lastly, to the alveoli. The tips of these bronchioles are where the alveoli can be found. So, up close, this is how the alveoli look. Parang grapes and lanzones. So this is where the oxygen and carbon dioxide exchange happens. So the oxygen from the alveoli goes to the capillaries through diffusion. It will be carried by the pulmonary venule to the heart for pumping throughout the body, while carbon dioxide from the pulmonary arteriole will reach the capillaries and then through diffusion will go to the alveoli and then will be expelled to the environment by the person. So that's the pathway of breath, or that's how the lungs work in brief description. However, in a person who smokes, the efficiency of the lungs are decreased because number one, he could have irritation of the trachea and larynx. He could have swelling and narrowing of the lung airways. Itong murag mga branches. Mukipot ang inside and muswell or muhubag ang outside, resulting to reduced lung function and breathlessness. Next, there will be buildup of poisonous substances resulting to lung irritation and damage. There will be increased lung infection and symptoms such as coughing and wheezing. It is the body's attempt to expel these irritants and these poisons from the respiratory system, but those substances will still be retained there, especially for chronic smokers. There will be wheezing, high-pitched sound upon respiration. And then there will be permanent damage to the air sacs of the lungs, the air sacs or the alveoli. What we are facing now is a disease which primarily attacks the lungs in the name of COVID-19. For more than a year already, we have seen a number of people die because of this disease, and a number of people got sick because of this disease. As a review, when a person gets infected, but not that severely affected, he could have fever, dry cough, flu-like symptoms, which could include headache, muscle or body aches, sore throat, runny nose, and fatigue. For severe cases, the person may experience dyspnea or difficulty of breathing, chest pain, hemoptysis or coughing out of blood, crackles. These are abnormal lung sounds which can be heard by the physician or by a nurse through auscultation nang maminaw sa lung sa tao na ibutang na stethoscope sa likod. Respiratory insufficiency, no matter how hard the person tries to get air, it's still not enough because the air sacs are already damaged because of the infection. Complications. Initially, it will be um, in the lungs. Sa lungs muna, there will be pneumonia. And then there will be acute respiratory distress syndrome. Severe injury na siya, life-threatening. Because the air sacs will be destroyed, will be damaged. That could lead to cardiac injury, arrhythmia, or irregular heart rhythm, septic shock, very low blood pressure, which could lead to death, liver dysfunction, acute kidney injury, and later on, that could lead to multi-organ failure, making it systemic, and that could lead to death. So who is at high risk of severe disease? Number one, we have the elderly, because with age comes also physiological changes, and we don't know if there are underlying diseases already in these people, so they are more predisposed. The immunocompromised, those people who take steroids, immunosuppressants, those cancer patients, because when they undergo chemotherapy, the bone marrow will be affected also, causing reduced um, production of red blood cells, including the white blood cells, which fight infection. Therefore, they are immunocompromised. AIDS, it's in the name already, acquired immune deficiency syndrome. And then we have those people who have comorbidities. The ones who have hypertension, diabetes mellitus, coronary heart disease, cerebrovascular disease, and obesity. That's why we appeal to you, our teachers and parents. If you already have maintenance medications, please adhere to those meds so that you'll be less vulnerable to the disease compared to those people who don't adhere to these medications. We have the fourth, the smokers. The smokers are said to be 1.4 times more likely to have severe symptoms of COVID-19 and approximately 2.4 times more likely to be admitted to an ICU or to an intensive care unit. Others need mechanical ventilation or die compared to non-smokers. So how is COVID-19 transmitted? We have number one, exhalation. So during normal respiration, inhalation, and exhalation, the droplet could reach up to 1.5 meters, while when the person coughs, that could reach up to more than 2 meters. When he sneezes, that could reach up to more than 6 meters. That's why we must remember to always practice our contra COVID-19 measures, which is the coughing etiquette, our frequent hand washing, our regular disinfection of articles which frequently come in contact with us or those things that we frequently touch and use. And there is the fourth one, the aerosols. What are aerosols? Aerosols are particles that remain suspended in the air for a few hours. Examples of aerosols are fog, air pollutants, and another is the smoke that comes from lighted cigarette. So what if that person is carrying the virus? He's just asymptomatic. He could be spreading it in the air because the aerosol can stay there, the smoke can stay there for 2 to 3 hours. Some books say 5 hours. And those could go with the airflow up to 20 feet, reaching other people and could be infecting other people. Now, this picture reminds us on how long the coronavirus can live on surfaces. So, on the outside of a surgical mask, it could stay there for 7 days, paper money 4 days, glass 4 days, plastic 3 days, stainless steel 2 to 3 days, cloth 2 days, wood 2 days, copper 4 hours, paper and tissue paper 3 hours, while on cardboard 24 hours. Now, what's the material of a cigarette? It is not paper and tissue paper, but it's more of cardboard, right? So what if these cigarette butts are disposed of improperly by a lot of smokers because the the survey says that we still have a lot of smokers. We are 15 globally pertaining to the number of smokers. So this could also be a source of infection. Now, how does smoking predispose you to COVID-19 disease aside from making your immune response low? It also predisposes you because to smoke, you must remove your face mask. Yes, and smoking in public, smoking areas puts you in close contact with others. Smoking requires repeated hand-to-mouth contact. Of course, if lighters are shared, contamination across users is facilitated, and exhaling the aerosol can propagate COVID-19 if the user is infected. This is what we mentioned a while ago. Now, why do the youth smoke? Number one is peer pressure. Peer pressure can be described best as a feeling that one must do the same things as other people of one's age and social group in order to be liked or to be respected by them. So when Pedro says, "Uy, Juan, suway po ka ani, join po sa amo kay ikaw ra may wala na nigarilyo pa, oy kami nakasuway ng tanan." Tendency is Juan will give in because of the influence that Pedro and his peers have on him. Number two, they think they will look cool. It is said that looking cool is one of the most concerned tasks of a teenager. And there are some who are ready to go to any extent para ma-achieve lang na ang impression on others. So kung in a group, smoking is mo'y in sa ilaha, or have you heard already of vaping or the use of e-cigarettes? So let's say that practice is in for this kind of group. So these kids could jump into these practices thinking that conforming to this trend makes them cool and in. Number three, we have curiosity. Teenagers are often very curious about their surroundings and are willing to explore many options. They have the urge to explore the unknown. Good if it is something that will help them grow as healthy and productive individuals, but if left unguided, they could fall into risk-taking behaviors. And one of that is the use of vices, including smoking. Number four, their parents smoke. Children look up to their parents as role models. So what they see in them, kung sila makita nga gibuhat sa ginikanan, will most likely be what they will also do later or sooner in life. Studies also say that children who are exposed to smoke could be addicted to it and later on use tobacco also. Number five, they want to smoke their problems away. Some people find smoking a form of stress relief, a source of pleasure. So this could also be true to teens who already practice smoking. But in reality, mawala ba ang problem? No. After the high or the pleasure that vices or smoking might give you, nada ang problem gihapon. And the problem could be compounded na hinoon madouble, since as we discussed earlier, there are a number of ill or harmful effects that smoking brings. So to our teens, our learners, it is but natural that you want to explore, know more of the world around you. And it's okay, it's part of growing up. But we must remember also that we must be responsible of our choices. We must reflect, will this thing do me good ba? And the people who love me? The human brain fully develops at the age of 25, and some books say 28. So layo-layo pa ang brain sa teenagers to fully develop. Particularly, ang prefrontal cortex kung tawagon, which is responsible for the right judgment and decision making. What is at play as of now, because you are in your puberty, and there are increases in estrogen and testosterone, is your limbic system, which also increases emotional volatility and impulsivity. So there may be times that you feel very sure, very certain of your decisions and emotions, but it could be nga dili pa di ay. So what is the best thing that we can do? We can confide or consult our parents, teachers, if what we deem right is truly right, so that we will be guided in making right decisions. So now, what is in tobacco smoke? A tobacco smoke has more than 7,000 chemicals. At least 70 of these chemicals are known to cause cancer. These are just some of the harmful chemicals that smokers inhale. Butane, hexamine, stearic acid, ammonia, benzene, arsenic, cadmium, carbon monoxide, which displaces oxygen in blood, acetone, methanol, acetic acid, toluene, nicotine, which is an insecticide. All of these are poisons and very harmful to the body. Now, what exactly is nicotine? Nicotine is a drug found in the tobacco leaf. It is highly addictive, and it's what tobacco companies love. It's gold for them because it's what keeps people coming back for more sticks to buy their cigarettes because people are already addicted. How does nicotine work? When you take a draw on a cigarette, the nicotine hidden in the smoke goes straight into your lungs. Di ba? Natay pathway of breath ganina. Nga musulod siya the same way with oxygen. It goes to the body, it will be absorbed into the blood, and it will reach the brain in 7 seconds lang. And then when it reaches the brain, it likes the feeling and it wants more. Then you will need another puff. Then you will need another cigarette. The more nicotine your brain gets, the more it wants. And then later on, when you don't smoke already, you get shakes, sweats, headaches, anxiety. You feel like hell. Di nakakasabot sa imong kaugalingon pag di na makasmoke. Mangita na kag cigarette per me. This is what we call withdrawal signs and symptoms. And these are just a few. Others experience um, insomnia. Others, abdominal pain, sakit ng tiyan. Others experience depression. So if patuloy ng patuloy, that person will really get addicted to cigarettes. And the tobacco industry has already got him hooked. Now we have these quick facts. According to studies, if a person smokes a cigarette daily, good for 1 year, there will be mutations in each cell. Na changes mahimo sa iyang cell, which could further lead to cancer, a lot of cancers. So for the larynx or the voice box, there could be 97 mutations, mouth 23, bladder, atong pantog 18, liver 6, pharynx 39, and the lungs 150. These are a lot. So what happens when you keep on smoking? Number 1, psoriasis. It is a non-contagious inflammatory skin condition that leaves itchy, oozing red patches all over the body. This is an autoimmune disease. And someone who doesn't have this, but if he becomes a smoker, it could be that he will develop this disease. Number 2, cataract, a clouding of the eye's lens that blocks light and may lead to blindness. Wrinkling. Skin ages prematurely because proteins and vitamin A get depleted with smoking. So instead of looking exactly your age, you could look a lot older than your age because of smoking. Hearing loss. Smoking creates plaques on blood vessels, decreasing blood flow to the inner ear. Cancers, ito. Smoking causes at least 16 different types of cancers. It is known to cause several cancers of the throat and oral cavity, as well as cancer in diverse sites, such as the bladder, kidney, stomach, and uterine cervix in women. Tooth decay. There is yellowing of teeth, no? That is because of tar and nicotine. Smoking interferes with the mouth's chemistry, creating excess plaque and yellowing of teeth. Emphysema. Do you remember our alveoli or air sacs? The one that we discussed a while ago? Those structures that look like grapes or lanzones. So when a person has emphysema, the air sacs are primarily affected. There is a swelling and rupturing of the lungs air sacs that reduces the lungs' capacity to take in oxygen and expel carbon dioxide. There is air trapping in the lungs, therefore it's very hard to breathe and expel air. Osteoporosis. Smoking cuts the oxygen carrying power of heavy smokers' blood by as much as 15%. As a result, smokers' bones lose density, fracture more easily, and take up 80% longer to heal. Heart disease. Ayan, smoking makes the heart beat faster. Stimulant kasi itong cigarettes. Smoking makes the heart beat faster, raises blood pressure, and increases the risk of hypertension and clogged arteries, and eventually causes heart attacks and strokes. So imagine if someone has comorbidities already, and then he smokes, and we are facing now COVID-19. It's truly a deadly combination. Stomach ulcers. Smoking reduces resistance to the bacteria that cause stomach ulcers. It also impairs the stomach's ability to neutralize acid after a meal, leaving the acid to eat away the stomach lining. Discolored fingers. Ayan. As what I've said a while ago, carbon monoxide displaces oxygen in the skin. Therefore, as a result, discolored fingers. Because nicotine will also reduce the blood flow. It leaves the skin dry and discolored. And because vitamin C and many nutrients are depleted, skin repair is harder for the body to do. So this will be the result. Cervical cancer. Besides increasing the risk of cancer of the uterine cervix, smoking can lead to fertility problems in women. So there is difficulty for women to conceive, or if they are able to bear a baby, it could be that that child um, will die soon after birth, or there will be miscarriage. Ayan, it increases the risk for low-weight babies. Gagmay ang baby compared to the normal weight. Therefore, there will be less chances of survival, miscarriage 2 to 3 times increased risk, and sudden infant death syndrome. Deformed sperm. Smoking can deform the sperm and damage its DNA, which could cause miscarriage pa rin or birth defects. It diminishes sperm count and reduces blood flow to the penis, which can cause impotence. Mabaog ang lalaki. So on the left side, this is the picture of a normal sperm, while these other 7 are the deformed sperms. Ang isa dako kay head, the other one smaller, the next one 2 heads, the next one 2 tails, the fifth one tapered head, sixth bent tail, and then the seventh one it's deformed towards the middle. This one, Berger's disease, also known as thromboangiitis obliterans. It is an inflammation of the arteries, veins, and nerves. Diba, we said a while ago that there will be plaque formation within the vessels, the blood vessels. And then there is decreased blood flow and oxygen supply. So that could result to this. There will be necrosis or cell death. Mamatay ang cells, kaya di naman siya maabot og maayo sa dugo nga okay pod ang amount sa oxygen. That's why if left untreated, it can lead to gangrene or death of body tissue. Mo ni gangrene na. And later on, pag wala na ilaing choice, hindi siya maayo, i-amputate na lang or putlon. Conclusion. Smoking reduces lung capacity and increases the risk of many respiratory and non-communicable diseases. COVID-19 is an infectious disease that primarily attacks the lungs. Smoking impairs lung function, making it harder for the body to fight off coronaviruses and other respiratory diseases, which makes smokers at higher risk of developing severe COVID-19 outcomes and most likely death. That this is according to the World Health Organization. So, how can we protect ourselves during this COVID-19 pandemic? Number 1, don't smoke. If your peers offer you a cigarette, just say no and be firm about it. Your no must be no. Number 2, let your friends know smoking is not cool. Inform them of the harms and disasters that smoking brings. Number 3, help friends or family members to stop smoking. Again, first, you may provide the person information on the harmful effects of smoking. Another thing you can do is help create change in settings or help change activities ba kaya that are associated with smoking. For example, kaside ka nga, ani mga panahon na si kuya kay manigarilyo na, mga na ganing orasa. Why not ask him to play his favorite sport? Baka kuya, basketball sa tata. Things like these that can distract him or your loved ones from smoking. And then we can offer them healthy choices, other things that will make them happy instead of the vice or instead of smoking. Examples, going on an exercise, planting, boxing, hiking, or watching movies ba kaya. While it's still early, let's help them stop kaysa mahimo na gyud noon siyang chronic smoker, which is most likely mas lisod pod ang pagbiya na noon. And we have this one. If you think or if you feel that you need professional help, you could go to a physician or you can reach this quit line through these numbers. They support counseling and support through the numbers that they provide. Either nag-initiate pa ka og quitting smoking or continuing na lang kay naka-start na ka sa imuhang journey sa pag-quit sa smoking. Avoid alcohol and illicit drugs. It's because more often than not, kung asa ni sila napod ang smoking, or it could be kung to ang smoking napod ni sila, vice versa. Then number 3, this is more on the COVID-19 pandemic. Practice frequent hand washing. Wash hands often with soap and water for at least 20 seconds. Use an alcohol-based hand sanitizer if soap and water are not available. I hope mga bata, kadumdum pa mo sa atong hand washing, proper hand washing. Diba? Mo ni ang steps. Number 4, practice proper coughing etiquette. Number 5, maintain distance at least 1 meter away from individuals experiencing respiratory symptoms. Much better gani og layo, diba? As what we have studied earlier, kung mga hatchi, it could reach up to more than 2 meters and more than 6 meters rather. And kung mag-ubo, more than 2 meters. So, kini lang siya ang pinaka-minimum, pero more than that, kung mas farther pa, the better. Consult a doctor if having a fever, feeling unwell, or having respiratory symptoms. Yes, in DepEd, we always remind you, our dear learners and teachers, that if feeling unwell, labi na kung fever ang gibati or flu-like symptoms, we must first contact our nurses or doctor or health workers in the community if what is the best thing to do. Kung okay lang ba nga mugawas ta and bugo sa facility or sila lang ba mo visit sa ato? Because it could be that we are carrying the virus if those are the signs and symptoms that we are manifesting. So it's also one way of protecting other people. Avoid close contact with sick people. Yes. Avoid spitting in public. This is one way of protecting other people. Dili magpatakagluwa bisag asa. Avoid touching one's eyes, nose, or mouth. Get plenty of rest and eat nutritious foods. Ensure that food is well cooked. Our food must be well washed and must be well cooked because we don't know those people who are handling this food in the market. And let's think na lang yun that COVID is everywhere so that inanagid ta ka vigilant kay kung complacent siya ta kaayo, we might be getting the virus sooner or later. Avoid unprotected contact with farm or wild animals, alive or dead, animal markets and products that come from animals such as uncooked meat. According to reports, animals that are found to have the COVID-19 disease, mga takdan po sila are cats. Sa akong nahibawan, cats, dogs, puma, gorilla, lions. Those are a few. And COVID-19, they say, is evolving because nanapoy new variants, right? So we do not know fully yet about this disease. So let's be careful and be vigilant about our practices. Now, let's watch and listen to this short video. This is titled Ashen Voices, the voice of Emer Rojas.
Si Emer Rojas ang pangulo ng organisasyong New Voice at isang natural na leader. May MBA siya mula sa AIM o Asian Institute of Management. Sumisikat na ang kanyang negosyo sa internet, maging ang karir niya bilang broadcaster sa radyo. Nang mapansin ng doktor noong 2002 ang cancer sa kanyang larynx o vocal cords. Ngayon, halos wala na siyang maamoy. Pati panlasa niya halos naglaho na rin.
Umabot nga sa point na medyo sobrang depressed. As in, nag-undergo siya ng depression na parang he wanted to end his life na.
99% sa kagaya namin is due to smoking. At sabi nga ng doktor ko, congratulations, you only have laryngeal cancer. Buti na lang, hindi raw lung cancer sa lakas ng manigarilyo dati.
Noong 2002, sinabi ng doktor na 5 taon na lang daw ang itatagal ng buhay niya. Kaya bonus na ang araw na to at ang mga susunod pa na panahon. Madalas ngayon magsalita sa Emer sa mga campus tungkol sa epekto ng paninigarilyo. Isa sa mga ipinaglalaban ni Emer ay ang paglalagay ng mga nakakatakot na larawan sa mga kaha ng sigarilyo tulad ng ginagawa sa ibang bansa.
Kind of diagram.
Kaya kahit hindi umusad ang bill sa Kongreso, tuloy pa rin ang mission ni Emer sa mga campus.
Good morning, good afternoon pala. Bakit kayo natahimik? Is this the first time for you to hear a person speak like this? Why did I have laryngeal cancer? Yes, it's because of smoking. How many of you are smoking?
What do e-commerce do, Well, basically, e-commerce or electronic commerce simply means
Napakasarap pakinggan ng natural voice. Buti na lang natin ko yung natural voice ko dati.
Medyo kakaiba yung boses ni Emer dahil may tawag siya dun sa siguro mama-explain niya, pero kapatid ko na si Emer sa atin pala dun Emer.
Magandang hapon po sa inyo lahat.
Si Arthur.
Opo, huwag niyo pong inilipat yung mga radyo niyo, hindi po si Ryan.
Nakukumbida pa rin si Emer magsalita sa radyo. Sa halip na maging sagabal ang di karaniwang boses. Nakadadagdag pa ito sa kanyang kredibilidad.
Kaya sa mga kababayan natin na ginagamit ang boses for their profession, ingatan niyo po yung boses niyo, iwasan niyo po manigarilyo. Dahil
Kahit may mga natutuwa sa boses ng boss, wala namang may gusto nito habang buhay. Kaya sa kampanya laban sa bisyo, may sandatang posibleng mas ganap pa kaysa sa larawan.
Yossi, nakakabuog daw to.
Ako po si Howie Sabrin at ito ang Eyewitness.
So that is the story of engineer Emer Rojas, a laryngeal cancer survivor and now the president of New Voice Association of the Philippines, which aims to help in the rehabilitation of cancer survivors and persons with disabilities, prevent cancer through education and tobacco awareness and advocacy. So I hope we heard well his message nga iwasan daw ang paninigarilyo and tigilan ang paninigarilyo. He now speaks through an electrolarynx since his larynx or the voice box was removed because of a laryngeal cancer he acquired because of smoking. May we not learn the lesson the hard way, and may we be able to stop smoking while it is still early. So for the references of this presentation, these are those. And before I end my presentation, let me leave you this line. Don't make an ash of yourself. Live life to the fullest and stay safe in this pandemic. I hope you learned from this presentation. Thank you for listening, and may God bless us all.